Evening, everybody. My name is Buffet Ilundu, and on behalf of our co-host tonight, UNFPA, the German government, the Population Council, and there's a fourth guest, the NEPAD. But I'd like to welcome everybody to this magnificent venue. The event that we have tonight has been billed as a side event, but I would venture to say that the label of a side event is true only in a very technical sense. I consider this event to be a core event of this year's edition. And I consider this to be a core event for three reasons. The first reason is symbolic. The second is more substantive, and the third is institutional. Symbolically, the building in which we find ourselves tonight has been named after Dag Hammarskjöld, who was Secretary General of the United Nations. And so you would agree with me that if you find yourself in the home of the Secretary General of the United Nations, it means you are at the core of the United Nations. There is a more substantive reason why I consider this to be a core event. This has to do with the nature of the themes that we're going to debate tonight. The themes that we're going to discuss are essentially the heart of all of the discussion that we're going to hear throughout this commission. And so the only advantage that we have here is that we're going to have a cozier discussion, a more intimate discussion, and I would argue a much more interesting discussion. Okay. And then there's a third reason why I consider this to be a core event, and it's institutional. You're going to have a chance to hear from a stellar cast of panelists who work with institutions that are at the forefront of dividend programming across the world, in different regions of the world, whether it's at the global level, regional level, national level, or even subnational level. We are going to have a chance to listen to them shortly. But before we do, let me introduce the first of our hosts to deliver her welcome remarks.
Thank you very much, Parfait, for that very stimulating introduction to this meeting this evening. I want to welcome you all on behalf of the Population Council. Thank you all for sharing your evening with us. And I want to say a very special welcome home to a very special person in the audience this evening, and that is Julia Bunting, who served as our president for almost 10 years. So Julia, we're so happy that you're here. Thank you very much for coming. We really appreciate you. So I'll say a few words about the Population Council. The council was founded with the belief that women, girls, and young people must have the opportunity to live full and productive lives, and is key to progress on economic and social development. Improving health and well-being, and particularly increasing access to comprehensive sexual and reproductive health care, has been core to the Population Council's mission for more than 70 years. The council has also been at the forefront of research efforts to transform the lives of adolescent girls. Through our Girl Center, we continue to generate evidence for policymakers to make the case that investing in young people is not only the right thing to do, but the smart thing to do. As you'll hear more about today from our panelists, and particularly those who are representing youth organizations, access to sexual and reproductive health care is essential to allowing younger generations to plan and to take full control of their own futures. I'm grateful to our partners and co-hosts in the room today, the UNFPA, Government of Germany, and the African Union Development Agency. We thank you very much for your continued partnership and for your commitment to realizing the health and rights of young people. I'd like to welcome our co-host, Ambassador Thomas Eisen, Deputy Permanent Representative of the Government of Germany to the United Nations. He will provide some additional remarks. The Council has a long history of partnership with the Government of Germany. Notably, we received German product development partnership funding to develop new technologies to prevent pregnancy, HIV, and other sexually transmitted infections. just one of the many ways we're collaborating to advance our shared goals. Thank you for your attention and enjoy the evening.
Evening, ladies and gentlemen. Very much. I use the first names and then I avoid the damage with their surnames. It's for me a really great pleasure and privilege to welcome together with all of you tonight. And this is really an important meeting, I agree. And I really want to thank our co-host, UNFPA, African Union Development Agency and Population Council for joining us, because, and I really want to say that strictly for saying that I really appreciate and value your leadership and your unwavering commitment of all the organizations that support our progress across the globe. I'm from Germany, so I come from a country that is already undergoing a profound demographic transition, or at least a generation. We're already struggling with how to balance the needs of a complex, highly globalized economy, consequences of an aging society. A couple of months ago, I was at a conference. I remember very well a presentation. It was on the outlook for 2050. And the presenter said two of the critical factors that will find stability of the nation will be access to water and a sufficient number of young people. If we look to 2050, already the world population will continue to age. By 2050, the number of persons under 15 years will be less than 20%. And in Africa, it will drop from today's 40% to 30%. However, until then, for the next decades, many countries will have a young population, and they have potentially highly dynamic workforces. And this is a huge asset that can drive sustainable development, inclusive growth. It can improve living standards, and it can increase social cohesion. But only if those countries are able to fully unlock the potential of these demographic dividends. This is by no means guaranteed. This dividend, the benefit must be well managed. It requires deliberate and sustained efforts and strong partnerships. And absolutely critical, it requires the right investments. Investments to create the conditions for unlocking the potential, especially in gender-sensitive education and health. And let's stay with health. It means in particular investments in health systems, strengthening health infrastructure, building well-trained and supported health workforce, and ensuring equitable access to essential services, including contraception and vaccines. But at the heart of these efforts and investments remains for us the recognition that every person has the right to live a healthy life. And sexual reproductive health and rights are integral to this vision. When people, especially women, girls, and marginalized communities, can make informed decisions about their bodies and lives, entire societies benefit. My country, Germany, will continue to be a trusted partner to those countries in their efforts to develop their demographic potential. It is our firm conviction that to achieve this objective, our efforts must be based on a strong commitment to human rights, gender equality, and the principle of self-determination. These values guide our cooperation, and they also reflect our belief that people must be empowered to shape their own futures. Empowering individuals with autonomy, access to accurate information, and quality services does more than uphold their individual human rights. It unleashes the full potential of communities and catalyzes progress across generations. To conclude, I want to underline that Germany remains a steadfast partner in advancing the program of action of the International Conference on Population and Development. To you, Population Council, and of course, UNFPA. And this includes our strong support for sexual and reproductive health and rights worldwide. We continue to partner with the Global Financing Facility for Women, Children, and Adolescents, and we've contributed substantially over the years. And through the Team Europe initiative on sexual and reproductive health and rights in sub-Saharan Africa, we are part of a joint European effort to mobilize, hopefully, approximately 1.8 billion euros for the years 2020 to 27. This is all in the belief that empowering individuals with autonomy, access to accurate information and quality services does more than uphold human rights. It unleashes the full potential of communities and catalyzes progress across generations. This being said, I'm very much looking forward to the debate today. I know very little about demographic dividend, so I'm very looking forward to this panel and the discussion we have, and thank you very much for your kind attention.
Okay, thank you. I'd like to thank the ambassador for framing the discussion so nicely. And we are going to gradually move to the discussion. He claims that he doesn't know much about the dividend. I beg to disagree. And so I'm going to just say a few words about the dividend. But before I do, I would like to just tell you about how great a cast of discussion we have today. They come from a variety of institutional perspective and personal perspectives as well. We have somebody from the International Federation of Medical Student Association. We have somebody from NEPAD. We have somebody from the Development Expertise Center in Ethiopia. We have someone from our own Population Council. And I'm going to introduce them just in alphabetical order. And then as I introduce them, I'm going to ask them to join the panel, the chairs, and then I'm going to say a few words on the dividend, and we'll start the Q&A, the round of questions. So first, we have David Martinez Gonzalez. He's a final year medical student based in Spain, and he's serving as a liaison officer for sexual and reproductive health issues, including HIV and AIDS, at the International Federation of Medical Student Association. He's passionate about health policy, HR justice, and youth advocacy in global health. Please welcome David. To him, we are going to welcome Linton Mchunu, who is advisor to the Chief Executive Officer on the Africa Demographic Dividend and Sexual and Reproductive Health Program within the Office of CEO of the Africa Union Development Agency, NEPAD. He previously served as Acting Director General of the National Department of Social Development and as Chief of Staff, heading the Ministries of Social Development as well as the Ministry of Small Business and Development. Welcome, Linton. Then we have Anna Mulugeta, who is a passionate youth advocate dedicated to meaningful and inclusive youth engagement in sexual and reproductive health and rights. As the youth country coordinator at the Development Expertise Center in Ethiopia, she leads youth-focused initiative under the Right Here, Right Now 2 program. Her leadership extends to global advocacy platforms, where she has contributed to great advocacy with the Dutch Ministry of Foreign Affairs Strategy for Africa and the Global Youth Village. Welcome, Anna. And last, in alphabetical order, but not least, we have Miriam Temin of the Population Council. She's an expert on adolescent girls, sexual and reproductive health, social determinants of health, HIV, and social protection. She leads the Population Council's work to promote evidence-informed girl-centered programming using evidence synthesis, technical assistance, and capacity strengthening. Miriam directs the Council's project to support the World Bank's SWED initiative in 7 countries with implementation support and monitoring, evaluation, and learning. Welcome, Miriam. So today's theme is really about unlocking the demographic dividend, a pathway to health and well-being for all. I think for this audience, we do not need to say a great deal about what a demographic dividend is. If we were to say just a couple of words, we can say it's a new idea. It's a new perspective on the connection between population and development. And what this distinguishes this perspective is that it makes 2 claims. On the one hand, yes, population does matter for development, but on the other hand, no, population, the effects of population, the reasons why population matters are not simply tied to population size or population growth, and hence we have to pay attention to other population forces such as age structure and especially the reproductive health of young people. And so that is the broad idea in great terms. Now, over the last 25 years that this idea has emerged, there's been a great deal of work and advocacy on this area. And the bulk of that work, the bottom line has been this. This idea is potentially powerful. The notion of a dividend is real. It has legs. Dividends can make a sizable difference in the effort to promote global development, but this is only a potential. In order to actualize this potential, which again is far and wide, it can accelerate not just economic growth, but it can also have effects on other aspects of sustainable development, including inequality, gender inequality, including health, including education, including security. So it's an idea with legs, but the potential to realize this idea rests on effective policy and sustained investment in the lives of young people, and especially in their sexual and reproductive health. And so why do we emphasize the need to invest in young people? There are a few arguments that have been clearly laid out, and we know a great deal about these arguments. If you want to have an effect that is immediate, right? You want to invest in young people because they are at a stage of their lives when they're making important decisions about education, about migration, about healthy behavior, about romantic relationship, having children, marrying, etc. So this is the moment where they are making decisions, and therefore investment at this juncture of their lives are going to make an immediate impact. Now, the impact is not just immediate. The impact can also be sustained for the long time. The decisions that they make as they are young are going to have repercussions throughout their entire lives, and including maybe trickle over the next generation. Third reason, these effects can spill over beyond other spheres, beyond reproductive health. If you invest in reproductive health, you are going to have secondary effects on choices about education, labor force participation, etc., etc. So this is the right moment in people's life to invest. This is the right group to invest in. And so we know why youth, and especially the sexual and reproductive health of youth, matters. What we don't know a great deal about, and what the panelists are going to tell us about, is how can we make smart investment in that particular nexus. And so I'm going to call on our speakers to begin to share their experiences regarding specific practices, specific policies that have been attempted in different places to make smart investment in youth. And so the pride of place is going to go, since we have been talking about young people and the need to invest in them, we are going to start with the youngest of all, Hannah Olugeta. So what I want to ask you is, in your experiences with the Right Here and Right Now program in Ethiopia, can you say something about the specific initiatives that have been successful in helping empower young people and helping them take leadership roles in advocating for their health and their rights?
Thank you. It's amazing to go first in this historic room. I'm audible now?
Yeah.
Yeah, great. So I'm going to speak up as well. Just on the topic of demographic dividend, I want to emphasize on how Africa is home to the youngest population in the world, and that I happen to come from one of the countries that greatly contribute to the numbers. Ethiopia, which is 70% of the population, is less than the age of 30. So, and regionally, to put this into perspective, we, the young people of Africa, decide to come together and form our own country. Then we'd be the third largest nation, right next to China and India. So that's a huge number. And to answer your question, I think working with policymakers requires a lot of persistence to make sure that these young people can push through and be part of all the processes of policy design, implementation, and evolution within the Right Here, Right Now 2 program that you've already mentioned. In Ethiopia, we've seen what's possible when youth are at the center of creating their own solutions. We've managed to build ground-shaking grassroots movements, and the news we've heard just in like 2 weeks ago is a testament for what I would refer to our monumental victory, which is after 4 years of relentless advocacy, our government announced that the gender responsive budgeting would be integrated into all aspects of annual budgeting, including sexual reproductive health education. For this to happen, our youth pushed through different workshops, different youth-led evidence generation work that they've done in Ethiopia, and also a series of policy briefs that have been flooding the Ministry of Health, the Ministry of Education, the Ministry of Finance, Treasury, the Women and Social Affairs Bureau, the parliamentarians. It's been a lot of work that has been done around there, and that's a lot of commitment from the youth as well. So this integration also gave us a lot of hope, especially in sustaining the work that we do within school gender clubs, which will now be funded by the government, ensuring reliable access to sexual reproductive health for students with or without our programs that are working in this grassroots levels. So this achievement is not just a policy win, it's a testament to the power of young people coming together, driving change and making their voices heard at highest levels. Our youth pool has also played a critical role in altering the adolescent and youth health strategy in Ethiopia. We've made sure that it wasn't just another paper, but a living strategy that responded to the realities of young people in different spaces, young girls, young persons with disabilities, and a wide range of diverse youth. So beyond health, we've supported the government in developing the youth policy that reflects our generation's needs, including economic aspirations, our rights to bodily autonomy, and our rights to be heard. So these are all great achievements, right? How did we do this? One is by organizing. We trained youth advocates across the country to speak the language of policy, the language of budget and data, evidence generation, and more. So capacitating the youth really holds a lot of space in pushing for these policies. The second one is partnering smart. We built a bridge with champions inside the government. We choose the collaborative approach rather than the combative approach with the government. So we have government allies that we call the Government Advisory Board for our programs and every work that we do. We also stayed committed. Change does not come overnight. As I said, it was 4 years of pushing that for some it can go up to 10 or more. So it comes through consistency and pushing through with persistence, I guess. So up to you. I hope I didn't take too much time.
Thank you very much. So we have here a successful case where your program was able to get youth to advocate for themselves through training and through smart partnership. And so that we're not accused of cherry picking and focusing on just one single success story, we're going to try to get a bigger picture and look at the program that has a broader regional foundation. And I'm talking about here the SWED program. And so can you similarly share what have been some of the success stories within the SWED program, Miriam?
Sure. Thanks very much. So for folks who don't know, SWED is an acronym, the Sahel Women's Empowerment and Demographic Dividend Initiative. It is a massive World Bank investment, initially started in 2015 in 6 countries, expanded to 9. Now it's up to 12 countries under SWED Plus, as they call it. And they are almost all francophone, with the exception of one, recognizing chronic underinvestment in that region. So in order to set up these countries in a position where they can ultimately achieve a demographic dividend, SWED and its design has multiple components. And the Population Council, through its Girl Center, was fortunate enough to work with UNFPA in their regional office in West and Central Africa to strengthen capacity of SWED actors, provide technical assistance, conduct research within the auspices of SWED. So I'm speaking to that experience. So there are 3 aspects of SWED's design that I want to highlight here. And as SWED works well beyond the health sector, that's an important point. So first of all, SWED, its design is multi-sectoral. So there are activities within the health sector and the health system, but also within schools related to education, and also within communities around empowerment and life skills programming through safe spaces, also social behavioral change campaigns. So many different elements. There are 3 government ministries, health, education, and a third that has various names, gender, youth development, et cetera, in different countries, plus implementing partners. So multi-sectoral. Secondly, SWED works at multiple levels. It recognizes that adolescent girls and young women do not live in a vacuum, but they are part of a socio-ecological environment. So SWED includes in its design activities with boys and young men through futur mari, married, future married men, and with families through community dialogues, and with national coalitions of religious leaders, for example. So addressing multiple layers of their social ecology is a second key element of the design that's really set it up well. And the third key element of the design is that it is adolescent girls and young women centered. I'll use girl centered as shorthand because time is short here. So SWED takes a girl-centered approach, which means that the perspectives, the realities, and the voices of girls and young women are really central to SWED, as my colleague here has been talking about, trying to put that into action through the planning, monitoring, as well as through programming to empower them and build life skills. So this, of course, enhances the accessibility of programming to put a girl's perspective at the center of planning, makes activities and materials more relevant, and it sets it up to scale with quality. And so the design, as we have heard, policies and programs require meaningful engagement. And this is especially critical to promote inclusion. So this is a point related to it being centered on girls. The most marginalized adolescent girls and young women in the most marginalized communities are at the highest risk of early and child forced marriage, for example, of early pregnancy. These are the outcomes that drive large population growth and undermine the potential to achieve a demographic dividend by being centered on the adolescent girls and young women and ensuring marginalized ones are reached, that SWED is on a path, hopefully, to setting up countries for success. Thanks.
So we beginning to hear new ideas, and this is exactly what we are looking for. And new ideas are likely to come from fresh minds and may dare say new blood. And so if we're speaking to a medical specialist, one of the concerns in the health delivery services is that it's one thing to reach people who can advocate for themselves and who have resources. It's harder to reach people who are non-traditional audiences. And so the question that I want to ask you, David, is what can you do in your field to create a more inclusive approach to sexual and reproductive health for young people in a way that reaches a wide audience?
Thank you very much for the question, and also thank you very much for inviting me. But a special thanks for including youth-led organizations like IFMSA in this important discussion, because we could be considered the main character of the demographic dividend. To discuss inclusion, first of all, we must first recognize and value the diversity of young people's experience, considering not only age as a defining factor, but also other realities, such as, for example, gender identity, gender expression, sexual orientation, socioeconomic status, or disability. A comprehensive approach to SRHR goes beyond health and well-being. It must also ensure that youth feel heard, safe, and respected in healthcare setting. A key element in achieving this is the implementation of comprehensive sexuality education, not only for youth themselves, but also for healthcare providers. This education must be grounded in evidence-based knowledge that enables providers to address sexual and reproductive health issues in a way that is free from discrimination and stigmatization. It is essential to acknowledge the significant barriers that persist today. These include the lack of access to adequate information, the stigmatization of adolescent sexuality, restrictive laws and policies, including the one that don't allow access to safe abortion and family planning, and the systemic discrimination and exclusion of vulnerable groups, such as the LGBT community, for example, young people living with HIV. To address the challenge, we need both short and long-term actions. We must invest in training healthcare providers to deliver youth-centered, right-based care and ensure the availability of confidential service in schools and community settings, and we must advocate for legal and policy reforms that guarantee bodily autonomy, eliminate age-related restrictions, and institutionalize TSC and inclusive SRHR service within universal health coverage systems. Addressing this challenge requires moving beyond Signed-Bill, offering youth-friendly service. We must embrace youth-centered perspective, one that not only acknowledges young people's rights and the diverse of realities, but actively involve us, the youth, in shaping the policies, the system, and the service that affect our lives. Being inclusive is not just about offering service. It's about doing so through an approach that reflects our reality, needs, and our rights in all our diversity. Thank you.
Well, thank you very much. I think we heard when we started with the first speaker, and to some extent the next two, we heard a lot of innovation at the grassroots. What I'd like to see is whether we have similar ideas coming from the top. And here I'd like to call on Linton to tell us a little bit about what the African Union is doing. How is the African Union demonstrating leadership in harnessing the dividend, and what do you see as some of the most innovative approaches in that area?
Well, thank you very much, and good evening to everybody, and thanks for the question, and again, thank you for the invitation as well. Firstly, and I'll make 5 points to respond to this question. Firstly, as the African Union, we recognize that sexual and reproductive health is a crucial enabler to sustainable development, as well as the empowerment of women and girls. And so the interventions that we employ are very deliberate interventions. We understand that Africa is going to have the largest youthful population in the next few years, and the extent to which we are able to harness that youthful population and get them active in the economy would largely depend on how we set the platforms now and how we prepare now for them, right? So that's the first thing. Secondly, we build political commitment, and building political commitment, we utilize our convening power to put heads of state in the room, put ministers together, and essentially policymakers to agree on the importance of issues around sexual and reproductive health, as well as the demographic dividend. And therein, we were able to take a series of decisions. You would know the Maputo plan of action that we've taken, and the process that we're trying to drive in that regard. We have the Africa Health Strategy, 2016 to 2030, and that strategy is aligned and links to the SDGs as well, but also that strategy highlights the importance of SRH. In fact, it's the second strategic objective within the entire Africa Health Strategy. And then, of course, you'd know that we've taken a number of decisions. In 2017, the AU, the theme of the African Union was harnessing or investing in young people to harness the demographic dividend. And so we get heads of state and ministers to ensure that we get the political buy-in to take these decisions and make sure that we are able to implement them. But you would agree with me that taking decisions is one thing, implementing them is another thing. And so what we do is we also assist in integrating and domesticating these decisions into programs and projects on the ground, and making sure that at the regional level they are implemented, at the national level they're implemented. But we go beyond that. We also assist in terms of monitoring and evaluation, or monitoring rather the decisions that we've taken. And as an example, next year we will be celebrating the 20th anniversary of the Youth Charter. And in doing so, we are going to be driving a process where young people are going to be involved specifically in that. Lastly, let me say that we've recently launched a program which is called the African Demographic Dividend and Sexual and Reproductive Health Program, which is a $100 million program where we invest that money into member states and regs and young people in terms of NGOs, etc., in trying to assist them to do a few things. One, in terms of policy advancements, you'd be surprised at the number of countries who have very outdated SRH policies, and we try to assist them by making sure that they're relevant and up to date. Secondly, high level and smart advocacy. Here we work with MPs, we work with heads of states and ministers to ensure that there is a multi-sectoral approach towards addressing issues of SRH. Thirdly, capacity building and institutional development, as well as program design. If I have to tell you the number, and my colleague spoke about the importance of investing in healthcare workers, there's one country which has a population of 14 million people in Africa, but you know that they only have less than 50 anesthesiologists in the entire country, and they have less than 100 midwives in the entire country. So we are assisting that country by quadrupling their workforce in the next 4 years, so that we could quadruple the number of healthcare workers. And that's an important intervention that we are making. Of course, research, innovation, Development is another one to ensure that we have evidence-based policy making. And lastly, domestic resource mobilization and health financing. Essentially, you would agree that yes, there's some donor fatigue, but also there is a realignment in the global order around how funding is going to be moving to various, partners, etc. I'll leave it at that and not go into the detail. But we are prioritizing domestic resource mobilization in Africa, and we're taking this from the African Leadership Meeting to ensure that we finance our own health initiatives on the continent. Thank you.
Well, thank you very much. Now, we have so far picked only one tiny side of their brain, which is what they learned from the work with their institution. They have so much more to offer in terms of all of the collaboration that they have established with other institutions. So with your permission, if I can just give each one of them a minute or two to talk more broadly about what some of these experiences can provide in terms of lesson. And I'm going to start in the same order. Hannah, I know you participated in the ICPD 30 Global Dialogue last year, which was about thinking about concrete ideas from youth. Right? What are some of the concrete ideas that emerged from youth in that dialogue that you can talk about?
So the demographic reality has already been cleared by Linton, and also I've mentioned a lot about it, but demographics alone do not create dividends, right? Decisions do. And that's exactly why the Cotonou Youth Action Agenda is so critical. The document shaped by over 400 young people coming from 130 countries does not make polite requests. It was making very clear demands. And this Youth Action Agenda reaffirmed that adolescent health and well-being cannot be addressed in isolation. And it must be approached through systemic, inclusive, and long-term investments. So I want to bring in three overarching themes that really stood up for me from that dialogue. First was that there was a clear call to move from just access to ownership, maybe. So young people just don't want to be accessing this youth-friendly services that are being set up for them in different spaces, because they're sometimes just there figuratively, like they exist in the form of a space, but they're very highly inaccessible, and they don't know what to do with them by going there. They're not physically accessible. They're not providing the services that they're requesting for. The second one is that the dialogue urged to shift from siloed intervention into integrated approach. And this is coming from the idea that young people need economic opportunities, digital access, mental health, protection from violence, and these different aspects of their health they need to be integrated in the policies that we're making. So a health policy that does not speak to this dimension risks being inefficient. So moving forward, this means we need to look into strengthening interministerial collaboration, harmonizing data systems, and also ensuring that adolescents focused policies cut across sectors. And finally, the dialogue reminded us that investment in adolescent health is not merely a social good, it's rather an economic imperative. There is a growing evidence that every dollar invested in adolescents' well-being yields a significant return in productivity, stability, and resilience. Yet in many countries, including my own, adolescent health remains under prioritized in national budgeting. To change this, we must elevate the conversation beyond health ministries. We need to involve other ministries as well. We need to include all relevant sectors, ensuring sustained financial commitment. So in essence, the dialogue called for reimagining of all our systems, maybe to ensure that policies of tomorrow are dynamic and diverse as the adolescents they're aiming to serve. Yeah.
Well, thank you, Derek. I likewise would like you to think beyond SWED, or rather after SWED. How do you make certain that the effort that you are undertaking now with these countries is sustained beyond the life of this initial initiative?
Yeah, critical question. And I'd like to mention again, three-part answer. Opportunities that SWED provides to really sustain its impact. And firstly, SWED includes activities to build a so-called enabling environment familiar to all of us. We've heard about high-level policy, and there is a component of SWED that conducts policy-related research and strategic communications around demographics. But it's not just about policy, capital P, important, but also changing opinions and building commitment at community levels through local government representatives of these ministries that were mentioned. So really all up and down the policy ladder within countries is vital. It really helps to build commitment when there's recognition and buy-in that when countries are doing well for adolescent girls and young women, they're doing well for everybody now and in the future. So how do we know how they're doing? Strong systems for monitoring, evaluation, and learning. So we heard about that from some of my colleagues here, vital to track implementation progress as well as impact at the level of girls and young women and at the level of communities. But in addition, you need real-time feedback loops. You need dashboards and you need apps. That a lot of mentor supervisors, for example, have devices that allows real-time access to information so that they can identify bottlenecks and identify solutions before these problems become large. The third point to underscore sustainability is that SWED is actually a regional initiative. So there are all kinds of ways to leverage the fact that it is regional and not just a multi-country initiative, promoting cross-learnings from experienced SWED countries to new SWED countries, peer support, problem solving, creating communities of practice, and dare I say, peer pressure. Fostering competition. This really underscores the need for good monitoring and evaluation. So leaders know who's making faster progress towards reaching the right appropriate adolescent girls and young women in order to reduce early marriage and birth rates. So in these three, the enabling environment at all levels, strong monitoring, evaluation, and learning, and making a whole of an initiative that is regional that is greater than the sum of the parts. Thanks.
Yes, thank you very much, David. I want you to likewise think bigger and think more about the future and specifically how to train the next generation of medical professional. How do we train medical professionals that can build a medical and public culture in which it's not just about meeting the physical needs of adolescents, but also their emotional and psychological well-being as well?
Thank you for the question. So first of all, as a representative of the IFMSA, acting on behalf of 1.5 million medical students from over 120 countries, I think that with 1 or 2 minutes, I don't have enough time to say all the concerns that we have about our training, about our education, and about our curricula, but I will try my best. First of all, for us, we have to envision adolescents and especially youth, not just as individuals or not just as patients or clients. We are individuals, but with complex identities, with different needs that the adults, and also with different needs from youth from other years. And also, we deserve respectful, empowering, and holistic care. At IFMSA, we are transforming medical and public health culture begins with transforming education. Our federation has long championed non-formal education and peer-to-peer learning as a powerful tool to complement formal training. We promote youth-centered, right-based approaches to adolescent health through capacity building workshops, global and local campaigns, and interactive sessions led by medical students. Per year, we host around 1,000 workshops and different trainings in different areas, especially in SRHR, having like more than 2,000 or 3,000 trainees per year, improving and also increasing the number of people that would like to be engaged in peer-to-peer education and training. And where training goes beyond biomedical knowledge, we give future healthcare providers with critical skills in empathic communication, trauma-informed care, and age-appropriate counseling. And we challenge the stigma and around mental health, sexuality, and gender identity, and advocate for a health system where confidentiality, trust, and safety are non-negotiable. In this context, self-care also emerged as a powerful tool. I don't have time to discuss about this, but we can do it later. And to meet the full spectrum of adolescent needs, physical, emotional, and psychological well-being, we must reshape how we educate and care. IFMSA is committed to leading the change from the ground up. So now my question for you is that if you are going to join us, the IFMSA, in being part of the change of the education. Thank you.
Well, thank you very much. And I think we are maybe going to end in the perfect place. I think Linton told us about the convening powers that you have at NEPAD. And so from this platform that we, how do you foster the sort of cross-learning that Miriam was talking about, how to build capacity and help countries address their programming in this area of sexual and reproductive.
Well, thank you. Thanks again. Let me first start by saying, and I'll make 5 points again here. But let me start by, I don't remember which point I'm on, but systemic issues require systemic solutions. And unless we have solutions that address the problem at the heart, we may be pitching in the wrong place. And so we're very deliberate about the kind of interventions that we make. Firstly, building strong partnerships to coordinate better and for greater impact. We have to realize that it's not governments alone who are going to drive change. It's government, it's civil, it's all sectors of society. Government, civil society, private sector, academia have a very critical role to play. And so the idea is that we have to harness our interventions and make sure that we coordinate better for greater impact. It's no use having 1,000 initiatives and they're not shifting the needle. We've got to be able to shift the needle, and a better coordination mechanism is what we got to do. So in Africa, we work within the process called Africa Team, and we coordinate amongst the regional economic communities as well as the member states and the other institutions. And I think this is important if we are to essentially ensure that we provide accessible, affordable, quality, and available health services to all sectors of society. And of course, the most important piece in this configuration is young people. In my days when I was younger, I used to say nothing about us without us. So we advocate for that and we get young people completely involved. Secondly, I want to just highlight the strengthening of institutions and systems to make them resilient against shocks, as we see right now. I won't go into the detail again, you know what I mean. But to ensure that we make them work, right? And I think that's another important thing that we need to do is really strengthen institutions. We have a program called Strengthening Institutions Supporting Vulnerable Communities. And through that program, we're able to help various member states to ensure that they have very solid institutions that would withstand whatever shocks that may come. Thirdly, I just want to highlight that, of course, another thing that we need to do, and we try to do this, is to enhance smart advocacy and really make sure that we reach the unreached. It's one thing talking to politicians, but the idea is that we've got to reach all of society. So we talk to community leaders, we talk to traditional leaders, we talk to young leaders, for example, we talk to beyond policymakers. And so the idea is to make sure that we popularize the work that we do and make people understand the importance of social behavioral change and the interventions that we need to make. Lastly, again, around the financing solutions, we built on the ALM, and we're in the process of creating a development fund for Africa, and because our work is development essentially. And the idea is that we're also trying to get member states to really ring-fence funding to drive their own programs. We have to get to a place where we ourselves fund our own initiatives. That's critical. And so we place a lot of emphasis on that. And we believe that if we invest in the health of people, of young people in particular, it has a ripple effect to create wealth. So health for wealth, essentially. Thanks.
Well, thank you very much, Health for Wealth. We're going to stop on this note. I'm going to beg to have a couple of minutes.
You want to take a couple of comments?
Yes, I would like to take a couple of, I would actually prefer additional insight as opposed to questions. But we are fine with questions as well. So we're going to have a rolling microphone. And so, Andrew, we have, we are going to split the difference. Maybe one question here and another on the other side.
My name is Josie Lutke. I'm from a Canadian NGO called Campaign Life Coalition. I do have a question, and that is, how do we reconcile the idea of human rights with the killing of innocent human beings through abortion?
Very much, moderator, Christopher Kamombe, Parliament from a country called Zambia.
Very quick intervention. You know that AU through NEPAD is doing something about bringing policymakers together, so that at that level there's progress, there's national commitment to activities. But what I wanted to find out from, and maybe an intervention, youth representative from is it Ethiopia? I remember 20 years ago when I was starting leadership, I think young people always have a huge role to influence policy at national level. I think that there must be a way, moderator, in which we get this understanding, because there's this understanding that the future is key. The future has to be relevant and platforms have to be created. But I think that there must be a way in which we get decisions influenced by the people who are affected by those decisions that policymakers make. So the Ethiopia practice, or the Ethiopia achievement, how do we get it out there into other countries that may need to copy what Ethiopia has achieved? Because Ethiopia is basically telling us that as young people we've managed. We are parliamentarians who belong to a caucus at parliament where we engage stakeholders. So how can other countries adopt that method so that these outcomes are achieved much faster? So for me, I think that we need to replicate what Ethiopia is doing, apart from what NEPAD is able to do at a national level. Thank you.
Very nice. And since we were very efficient, I can see another young person there and another young person here. Otherwise, I'm going to.
I'm 40.
We have to go.
Thank you so much. Yes, maybe to the African Union and maybe to the Ethiopian lady. I know for a fact that, I used to report about, demographic dividend since it came out like in 2010 when I was a journalist in Uganda. I now work with Population Connection, which is based in the US. But I would love to know what role, fertility reduction plays, because I know to achieve the demographic dividend, we really have to reduce fertility, which is still an issue in the developing world, especially sub-Saharan Africa. There's no way we are going to achieve the demographic dividend, which we've sung about for some decades since it came on the line. So where does this fit in, especially for our continent? Sub-Saharan Africa in particular. My country is Uganda, which has one of the highest fertility rates. She's going down, but of course with the cuts, which we don't want to talk about loudly, this is going to affect us. COVID took us back. These cuts are taking us back. So how are we going to help our young people? 7 out of 10 girls are still not completing primary school in my country. They're falling out, they're getting married, and they're, childbearing, they're dying. So how do we address this? Thank you.
I didn't. Okay, just one question. Yes. And please, an easy one.
Thank you very much, Mr. Moderator. And I also want to thank the panelists for giving us insight to what they're doing. I'm of the Nigerian delegation to the 58th session of the CPA. My question is connected to what Florence just asked. The United States of America have dismantled the USAID, which gives funding to most African countries to run projects and implementations of policy, particularly around issues of demographic dividends, young people, sexual and reproductive health. And the African government have not said a word to it. And you spoke about resource mobilization and funding and financing. Like when it happened, I said 2 things. It's a challenge and it's also an opportunity for the Africans, particularly, because that's my own jurisdiction. It's for them to come back home and then mobilize their own resources. We have money in Africa, we have money in Nigeria. How are we going to harness the money we have, prioritize what is important to us to harness demographic dividend, starting from the African Union, because when they launched the roadmap, they asked member states to do same, and they did. Nigeria launched their roadmap also in 2017. But implementation of that roadmap have been very, very sluggish. And we need to run now. I hear everybody saying 5 years. For me, it's 4. Because 2030 is an evaluation year. So you cannot count it as an implementing year. So we have 4 years to go. So what is African Union doing to mobilize resources at the continental level and at member states level to ensure that we address issues of sexual and reproductive health and position ourselves to harness the demographic dividends? Thank you.
Thank you very much. I think this. Your permission?
One more, we're still. You can take one more.
Okay, one more, and no, are we going to have any answers? Okay, so one last question, and then you get a stab at any answer that you like, very quickly. Then we'll continue the discussion in private conversations.
Yeah, so thank you very much for this opportunity to ask. For me, it's going to be a comment. My name is Gloria Langat. I work with the APHSC based in Nairobi. So I think a lot of focus on sexual and reproductive health is on preventing pregnancy and early marriage. So when we think about demographic dividends, we are thinking about that population that has not started childbearing. But that's really not the reality for most of Africa. So we need to really be more inclusive, bring in the population of young mothers, reintegrate them into education, bring them into retraining. And I think a lot of programs that are looking at the technical colleges, majority are actually people who are already either married or with children. So we need to think about this huge population of people who have already started childbearing, because that's a reality for most of the young people in Africa. Thank you.
Thank you very much. And so let's just give the microphone here for a quick answer. If you dare take a stab at any of the questions, you just, anybody wants to answer any of the questions that were raised very quickly? Yes, let's start with David and then David down the line.
Yes, so I would like to say that bodily autonomy is a human right. And this is something that IFMSA and also medical students worldwide, we are continuing advocating for. According to the medical knowledge and also the research and also the evidence, a fetus is not a human. So we cannot ensure human rights for a fetus because it's not a human. And also I would like to say that abortion is going to continue happening. The difference is that people from low and middle income countries, people without access to safe abortion, are going to have an unsafe abortion, and probably they are going to die. This is the difference between having low.
Thank you, Levinci, to maybe 2 or 3 questions. One is, so what are we doing in Africa? We particularly members of parliament, there's a process called NEPAD, which is a gathering of MPs. So we gather all MPs across the African continent to meet, engage, share best practices, and indicate progress on how their countries are essentially doing in terms of the ICPD commitment. So we support that process and we work with the institutions of the continent to do that. We just had a meeting about a month ago, and I think that process is going fairly well. Secondly, the issue around aid being, reduced into Africa, we have to be responsible for driving our own developmental agenda. That's key. Whilst we can engage with partners outside, but we have to take deliberate steps in driving our own agenda. Let me give you an example of just one of the things that we are trying to do. At the moment, we have about, depending on which country you are at, about 70% upwards of medicines are imported into Africa. We get them from different parts of the globe. We're not manufacturing them at home. So we've now we've started a process of designating 24 medicines that will be manufactured in Africa. And we are going to place a moratorium on these medicines in the next 4 years, so that at the moment we're busy getting systems ready, and we will be manufacturing our own medicines, 24 of them. 65% of those medicines are for maternal, newborn, and child health. So that's what we're doing practically to try and ensure that we drive our own developmental agenda. Lastly, I just want to say that yeah, I mean, what we've also done is we are trying to get member states to ring-fence a certain percentage per annum towards maternal newborn and child health. I think that's important in Africa. That's what we're trying to do. But to the last question which was asked, which I thought was a very important question. Firstly, there's something we need to place emphasis on, and that's strengthening families. Irrespective of where you come from, it's not the university, it's not the church, it's not the sports club and anywhere else that is going to drive the message home like your family would. So we need to strengthen the family unit and ensure that social behavioral change starts in the family. That's what we need to do before we can rely on other institutions, etc. So this aspect of strengthening families is something that has to be core to what we do so that we drive the social behavioral change. Thanks.
Yes.
Just to also emphasize what was already asked, but it's also an answer, I think. We really need to organize ourselves in regional spaces and also make sure that our national development policy doesn't just stay to Ethiopia and also learn regionally and think and learn also programs in the global sense as well. We do national advocacy, but we also do regional advocacy and work with the Eastern African countries that our programs are being implemented in, which is Uganda and Kenya, and also in the north of Morocco, Tunisia, and also West Burundi and Benin. And we don't have any organizations in Southern Africa, which we're really open to exploring. And it's also usually based on the resources that we have. So as resources come in, then we'd like to expand this network of youth within the region and also beyond. We engage with the Human Rights Council and UPR advocacy. We also do some youth-led shadow reports and preparations in that whole sense. So we try to reach the area, but it's also I also want to support what you said. We need to think and learn and sure that the work that we do is not just
Thank you. Amir?
I'm not sure I should have the final word, but I will just pick up two aspects of the point from our colleague from APHRC. Again, thank you for that. One point that not all adolescents are the same. So we use that phrase to describe this very heterogeneous swath, of course, within countries and on continents, and the point about pregnant and parenting adolescents, whether they're within marriage, outside of marriage, we need to take account of the heterogeneity in programming, which brings me to the second point about the importance of evidence. And we've heard here mentions of evidence-based, evidence-informed programming and policy critical. So there's an important piece of evidence around young women in Kenya, perhaps. I'm not sure what population you're talking about, but that is an illustration of why it is so vital to ensure that we are continuing to support learning alongside policy and programming. And I will end with a call for global access to quality daycare.
Thank you very much. Okay, well, I'd like to invite you to say, give a hand to this. A lot more where these ideas came from, and so you'll have a chance to discuss with them during the conversation that we're going to have privately. And so we're going to move close to the end. I would invite you, you can stay there. I would invite Julia Banton, our own Julia, who is in a sense returning home to deliver the closing comments.
So moderator in Zambia will say, yeah.
So thank you, Parfait. Thank you, panelists. Thank you, everybody. I'm going to struggle to do justice to what has been such a rich conversation. And I think it could have gone on for a lot longer, and I'm sure we will continue afterwards. I think the insights that were shared really underscored the critical role of investing in health, and particularly the sexual reproductive health and rights for achieving the demographic dividends and achieving sustainable development. Linton, as you said, SRHR really is the driver of sustainable development. As we think about it, it's been really clear to me that this is not just a theoretical concept, it's a big concept. The demographic dividend is a very big concept, and it is complex and multifaceted. But it really is a tangible pathway to empowering adolescents and young people, improving lives, and building more equitable societies. Our discussions have highlighted the major challenges of health inequalities and the impact that that has on again, driving sustainable development, and particularly the persistent lack of access to essential health services, which undermines the fundamental right to health. We've also, in this conversation, in this brief conversation, but very rich conversation, explored some of the key solutions and strategies to overcome some of these obstacles. The importance of integrating SRHR into primary healthcare, into universal health coverage, is essential for ensuring that we build universal access and resilient health systems. As many have said, there's the importance of integrated health, but health is part of a broader package of human capital development. I think we need to think about writ large. We talked a bit about the ministries of health. I think, Hannah, you mentioned not just ministries of health, but a whole sort of cross-government initiative is needed. And we all recognise that empowering adolescents and young people through evidence-based, as Miriam just said, until I spent time at the Population Council, is going to be really vitally important as we seek to drive that progress. I think a key thread that's come through these discussions this evening is the indispensable role of young people in shaping and driving this agenda. Hannah, you made reference to the Cotonou Youth Dialogue that UNFPA organised in Benin this time last year. Again, critically important. And particularly that it's not just about for young people. I think, Linton, you said it's nothing for us without us, but young people's role as meaningful and inclusive is really going to be what's going to be critical to, again, to achieving the progress that we're looking to. We highlighted contributions of young people being able to advocate for their own health and rights. Again, Hannah, you talked about the long-term persistent work that you've done with the government in Ethiopia to advocate for those health and rights and ensure that the services are inclusive. We've talked about the disabled people, for LGBTQ populations, a whole range of populations that are going to need to have access to these critical services that are responsive to their particular needs. David, you talked about making sure again that the services that we provide for young people are also to support their emotional and psychosocial well-being. You talked about the importance of comprehensive sexuality education free from stigma and discrimination. For UNFPA, we remain committed to working with partners, all of the partners gathered here this evening, government, civil society, other UN agencies, regional alliances. And we have a long history of working with women-led organizations, with youth-led organizations, and the presence in many countries around the world, which is really critical for sustaining these strong partnerships and building the long-term capacity needed for these changes. Through our work as UNFPA, we offer a range of tools to help countries to characterize their populations, to use their data, their censuses and other data, to identify gaps and needs, and again, to make sure that evidence informs policies and programs. And I think, Parfait, you talked a lot about sort of the multiplier effects of these investments, and we often talk about the many and multiplying benefits that come when you invest in young people, when you invest in sexual and reproductive health. Those benefits are many and multiplying across families, across communities, across societies, across economies. And so how do we support people to be able to attain and achieve those rights? And particularly young people, again, is going to be really critical for the 4.5 years. I'm still saying 6, but anyway, to achieve the Sustainable Development Goals. In terms of the SWED partnership, and Miriam said it started in 2015, I joined the POP Council in 2015. It was one of the first programs I ever got involved in. So 10 years on, it's critical to see the progress that is being made across West and Central Africa as we generate demand for reproductive, maternal, newborn health and nutrition services, as we reinforce regional availability of commodities and qualified health workers. Again, David, something you talked about, the importance of the health workforce, the importance of promoting social and behaviour change and the empowerment of women and adolescent girls, including issues around, again, the comprehensive approach, including gender-based violence and harmful practices. You touched on child marriage, and we can't forget. Parfait, I was interested when you were talking earlier about the importance of having fresh ideas and new blood, but we're sitting here in the aura of Judith Bruce, who has done so much on these issues so many times. So I think it's also about learning from what we've learned, and again, what you've taught all of us about the importance of investing in holistically in adolescent girls and young beings, and again, the many assets that we need to support them to build in order to achieve their full potential. I've learned a lot and channel your wisdom many times. At UNFPA, again, our work around the world is to support programme countries on these critical and crucial interventions, and we remain committed to continue to do our part, including in partnership with all of you. And I think, again, the importance of political leadership, and again, hearing you talk, Linton, about the
incredible work that the AU has done on these agendas, including going to the Maputo, which is now what, 20 years old. Again, really at the forefront of thinking about a lot of these issues. So that is absolutely critical, particularly, as you said, for achieving impact and impact at scale. And so I'd like to just end in some ways by almost reframing the title, because I'm very conscious it says unlocking the demographic dividend, a pathway to health and well-being. But I think it's also the other way around. We're only going to achieve the demographic dividend, we're only going to achieve economic growth and development and poverty reduction if we invest in the health and well-being of all people. And that's what this Commission on Population and Development is about, is health for all at all ages. And I think we have to really now figure out what is it going to take to have not just health as an outcome of economic growth and development, but recognizing that it's an input to that. So I think as we continue these conversations this week, as we continue these conversations through the year, we have the high-level political forum coming up, which is going to focus on national voluntary reviews around SDG 5 on health, SDG 3 on health, SDG 5 on gender equality. Again, we've got to keep these conversations, we've got to keep joining up the dots, because this is not a simple sort of a single input into, single output out. This is really, really complex issues, again, centering people in what we do, particularly centering the needs of young people and making sure we provide comprehensive integrated approaches. So thank you to the Population Council, to Germany, to the AU for hosting this event tonight and starting these critical conversations. I hope they continue over refreshments, and I hope they continue through the rest of this week. Thank you.
Brilliant way to end. And out of everything you said, I just remember the term that I think we are going to leave this room with, which is the term of partnership and global conversation. And I think I can draw from African traditions to emphasize this idea of partnership. The Kikuyu of Kenya say a single hand cannot fight a knot. And so it's going to take all the hands that we have here on deck. And it's a good thing that this event was co-sponsored by 4 different institutions coming together. And I hope this coming together is going to continue. Now, you are Brit, and so I'm going to, in honor of the Brit would like you to sing for your supper. So I believe you deserved your supper tonight. Everybody did a good job with the panel, with the Q&As, and so the food is ready. And so we're going to move to the mineshaft part of this, right now, in the spirit of community. We are going to continue the conversation over a meal. And so where the directions are, we go to follow the leader here, and conversation continues. Thank you very much, everybody.